Q.1 A nurse teaches women in the fertility clinic that after ovulation has occurred, the ovum is thought to remain viable for A. 1 to 6 hours, B. 12 to 18 hours, C. 24 to 36 hours, D. 48 to 72 hours. Right answer. C. Rational. The ovum is capable of being fertilized for 24 to 36 hours following ovulation. After this time it travels a variable distance between the fallopian tube and uterus, and if not fertilized, disintegrates and is phagocytized by leukocytes. Q2. A nurse is teaching clients to determine the time of ovulation by taking the basal temperature. What change is expected to occur in the basal temperature during ovulation? A. Slight drop and then rises. B. Sudden rise and then drops. C. Marked rise and remains high. D. Marked drop and remains lower. Right answer is A. Rational. As ovulation approaches, there may be a drop in the basal temperature because of an increased production of estrogen. When ovulation occurs, there will be a rise in the basal temperature because of an increased production of progesterone. Q3. Oral contraceptives are prescribed for a client. What side effect should the nurse inform the client might occur? A. Cervicitis, B. Ovarian cysts, C. Breakthrough bleeding, D. Fibrocystic breast disease. Right answer is C. Rational. Breakthrough bleeding commonly occurs when clients begin taking oral contraceptives. It is mid-cycle bleeding, and if it persists, the dosage should be changed. Q4. One of the responsibilities of a nurse in a fertility specialist's office is to provide health teaching to the client in relation to timing of intercourse. Which instruction addresses the best time to achieve a pregnancy? A. Midway between periods, B. Immediately after menses end, C. 14 days before the next period is expected, D. 14 days after the beginning of the last period. Answer. Right, C. Ovulation occurs 14 days before the onset of menses. Q5. A nurse teaches a client that a postcoital test to evaluate fertility should be performed. A. 1 week after ovulation, B. Immediately after menses, C. Just before the next menstrual period, D. Within 1 to 2 days of presumed ovulation. Answer. D is right. Rational. At this time, because of increased estrogen levels, the cervical mucus is abundant and its quality changes in such a way as to optimize sperm survival time. Q6. A histogram, hysterosalpingography, HSG, is performed to determine whether there is a tubal obstruction. The nurse concludes that infertility caused by a defect in the tube is most often related to A. Tubal injury, B. Past infection, C. Fibroid tumor, D. Congenital anomaly. Answer. Right is B. Rational. Past pelvic infections may result in tubal occlusions, most of which are caused by post-infection adhesions. Q7. A client past menopause undergoes an anterior-posterior colporrhaphy. What should the discharge teaching include? A. Eating a high-fiber diet, B. Limiting daily activities, C. Reporting signs of urinary retention. D. Observing for signs of a rectovaginal fistula. Answer is A. Rational. Immediately after this type of surgery, pain is associated with bearing down. The client should be instructed to increase fluid, fiber, and activity to prevent constipation. Q8. What potential complication does a nurse anticipate when admitting a client with the diagnosis of severe procidentia? Prolapse of the uterus. A. Edema. B. Fistulas. C. Exudate. D. Ulcerations. Answer. Right is D. Rational. Ulcerations may occur when the vagina and uterus are displaced and exposed. Q9. A client with a third-degree uterine prolapse is scheduled for a vaginoplasty. What should the nurse anticipate the surgeon will order? A. Encourage ambulation. B. Elevate the foot of the bed. C. Apply moist compresses to the uterus. D. Support the prolapsed uterus with a sanitary pad. Answer. Right is C. Rational. Moist compresses may be ordered to prevent ulcerations. Q10. What resting position should a nurse encourage for a client with pelvic inflammatory disease, PID? A. Sims. B. Fowler. C. Supine with knees flexed. D. Lithotomy with head elevated. Answer is B. Rational. The Fowler position facilitates localization of the infection by pooling exudate in the lower pelvis. Q11. A nurse explains to a client with cervical erosion that early treatment of the erosion can help prevent A. Cancer of the cervix. B. Pelvic inflammatory disease. C. Unexpected vaginal bleeding. D. More erosions from occurring. Right answer is A. Rational. Erosion of the cervix frequently occurs at the columnosquamous junction, the most common site for carcinoma of the cervix.